Welcome back. We're here at the second day of the Friday Drinks and Sawira Marketplace, and we've got interesting people who've flown all the way from Harare, very important people as well. And this time around, it's CIMAS. So we've got somebody who knows what they're talking about, who's new on their job. Apparently, they've just been promoted to, marketing manager, Mr. Gaka. Thank you very much for joining us.
Thank you, gentlemen. Really excited to be here.
Yeah.
Yeah.
Okay. So,
are you guys still a society, by the way, or you're in the process of changing that?
No, yes, we are, but the society has given birth to a health services group that offers more than just medical aid.
Oh, okay.
Yeah.
All right, that makes sense.
So, Manatsa, maybe to start off with, just give us a bit of background on who CIMAS is and what do you guys actually do?
Right. Thank you very much. I think from the outset, we are an 8-year-old organization. We're celebrating our 80th anniversary this year. And this speaks to the credentials and the credibility of our institution. We are known as a medical aid organization, but we're more than that. And this is entrenched in our purpose, which is inspiring healthier communities. So you'll notice that when you look at the structure of our organization, it's beyond just processing claims and ensuring that members get medical health care services. We have morphed and really grown into beyond just a medical aid. We've got an integrated healthcare system that ensures that we've got what we call the blue zone, where we've got clinics in there, we've got pharmacies in there, and all that is for the benefit of our members so that they're able to access their services as they would. And we're cognizant of the fact that beyond providing healthcare services, we are supposed to ensure that we focus on wellness and well-being of the individual. So the latest child to our 80-year journey is CIMAS IGO, which is our wellness brand. So it's something that we're really excited about. And I'm actually excited that in the coming month, we'll be having the CIMAS IGO Marathon. That is just a commemoration and celebration of the great work that we're doing in terms of wellness. So I think in summation, that's who we are.
Oh, fantastic. So you're actually older than Zimbabwe.
Well, I guess.
As an institution, which is fantastic because it tells us
But then one would argue that Zimbabwe was always present in the hearts and minds of our forefathers. It always existed before independence.
Yeah, that's true. That's true. That's very true. But it also tells us that you've run through the lifespan of most people where, they've picked up your product early on up until they've actually, retired or expired, which is great because it tells us that you actually fully understand the healthcare needs of Zimbabwe. That's where I was trying to get to.
Oh, absolutely.
Could you maybe just give us a bit of color of what are the healthcare needs of, Zimbabweans?
Right. So Zimbabweans have got a hierarchy of needs, and the most apparent are your physiological needs. And those are apparent for all of us to figure out and notice. But for us as an institution, we have gone beyond just the physical needs. And we feel that Zimbabweans have comprehensive well-being and wellness needs that need to be catered for. And before I get into too much detail on that, what I just want to harp on is there's a great concern for us that we are picking up as an institution, the rise in non-communicable diseases. And this is what has actually given birth to our strategy to focus on CIMAS IGO, on wellness, and just ensuring that we focus more on preventative measures rather than trying to come up with treatment when, individuals are actually now already in trouble. Yeah.
For the purposes of clarity to the audience, when these diseases are basically lifestyle diseases.
So when we talk about non-communicable diseases, we're talking about things like hypertension, things like diabetes, Those are the things that we feel are on the rise, and we should be finding mechanisms of how we can actually stop this. Right?
Sure. Yeah.
And it's about behavioral change from a lifestyle perspective. So we've tried to address some of these issues from a technology perspective. We recently came up with what we call the HealthSync app. It's like a digital app that's able to track your vitals, your input, your benefits are in there. You're able to track how you are performing as an individual, which means you're able to track the journey of your health beyond your visits to the clinic. So this is from the technology side, but we just feel that as Zimbabweans, as individuals, we need to do more just to be healthy. And this reduces the burden that the medical aid ultimately has in terms of being utilized by Zimbabweans.
And what's the reception like for your products and for your campaigns?
So behavioral change is never an event. It's a journey. I think the burden is on us, not just as CIMAS, but as a sector, as medical aid, and even healthcare in general. I think we need to drive and ramp up and amplify, health promotion more than anything else. I think we need to push positive behavioral change communication that focus on health and healthy lifestyles. And I do think when we look at as a separate issue, when we look at the great strides that the health sector has made in terms of addressing the prevalence of HIV/AIDS, from where it was to now, I'm sure the prevalence is below 15%. That is quite impressive, and it's great work that has been done. When we look at the great work that the government as well as the health sector has done in terms of addressing the COVID pandemic when it happened, it just goes to show how well, when we come together, we're able to address issues that we have. And, it's not wordplay, but coincidentally, our payoff line is together we make a difference. So I think this collaboration, this coming together is what's important. And just to provide context for this, it is the same reason why the Manatsa Marketplace is relevant to us, because we feel that the best way we can address issues that we have is through collaboration, and we feel that this platform is a relevant platform for us to deliver what we need. We've done our research. We know the contribution that the diaspora is making to the country. We know that some forecasts are even anticipating remittances of just under 4 billion coming into the country.
And that's formally. There's probably much more that's coming through
that's
informal channels. Yeah.
True. So we feel the diaspora can play a role in terms of health as well, and that's why we've sought to be part of this great initiative. That, when I look at it in hindsight, is a no-brainer. Should have started it earlier, actually.
Yeah, well, I must give you guys kudos, because as a runner, I remember I used to sit on the committee of one of Harari's biggest running clubs about 7-8 years ago, and IGO reached out to us and organized a run as part of their wellness campaign. And I think you guys were the first actually to get onto that wellness initiative in this country. And the runners are really quite. I think because of initiatives like IGO, we saw a lot more people getting interested in running.
Becoming healthier.
Absolutely.
Yeah, it's about making it cultural. It's about making it a lifestyle. It must become commonplace. That's what our ambition is. And the short answer to the question that you asked is that, we think we're making inroads. We're seeing the running clubs, the fitness initiatives I think we just now need to dig in and make sure that is cultivated, not only in the generations that are here now, but even to our children. I think that's definitely what we need to do.
Fantastic.
Yeah.
So maybe let's speak directly to the diasporan market that's out here in the UK.
Yeah.
If they want to sign up, what are the packages that are available for their relatives and family back home?
Yeah, thanks for that question. So, what we have available is the already existing portfolio of products that we have under HealthSave and the Secure range. And these cater for the breadth of all segments, from as low as $7 to the premium ones at $203. This is the existing portfolio that we have. But when we decided we wanted to participate in the Nyaradzo marketplace, we felt it would be prudent for us to tailor a package that would be in line with the needs of the diaspora. So we obviously took time to do our homework to try and understand what would be more relevant to them. And what we know is the diaspora have got dependents that they left back home. And of the dependents that they left home, the most vulnerable ones are the elderly. So we crafted a product that we're calling 60 plus that is targeted at the vulnerable dependents that are beyond 60. So I think this will be one of the very first platforms that Zimbabwe is going to get to find out that we're actually opening up a review of applications, since we had actually stopped on that. And I'll just take an opportunity to try and explain how a medical aid works, because usually, we get questions like, I've been using medical aid for years and years. Am I not keeping my balance? What's happening? What's with the shortfalls? So as I explained earlier on, it's like a mutual society where we pool resources and funds into one pot. So what it means is when you're able to access a benefit, it balances with those that are not actually accessing the benefits that are there. So there hasn't been a drive from most medical aids to want to go for the elderly because of their high utilization of benefits and chronic conditions. But what we are saying is that we want to ensure that we have a mix that has both the young and the elderly. And our way of giving back to the diaspora is that we're going to come up with an offering, a value proposition that takes care of those that are important to them. And obviously what this also means is that we're going to be opening up a review of packages even for our local market as well. And obviously we will be assessing how this works, but our intention is that to ensure that we maintain a viable society that benefits most of the people.
Let's speak directly to this package that you have for the diasporans and their dependents who are elderly, 60 plus. What are the benefits that the diasporans and the elderly can get from this package that you have?
So we've actually come up with what we feel is an affordable package. It's right in the middle at $70 for the dependent, and what it gives them access to primary consultations to medical doctors. It also gives them access to diagnostics so that they can get tests done. It gives them access to our ecosystem of integrated healthcare to ensure that we're able to track any ailments that they have, to also just anticipate whatever issues that they may have. What I will say is that at this point in time, there is no provision for chronic meds at this point in time. But what we're doing is that as we're engaging with the diaspora, as we're also engaging with the dependents that fall within the target market in the last mile, we're going to be sharpening the product offering so that it's relevant to the dependents that are there, and we can ensure that the best value is delivered to our members and their beneficiaries. Yeah.
Okay, fantastic. And why should someone use CIMAS and not anyone else out there?
So the question you've asked me is a difficult one because it forces me to say that we're the best in the market. But I will say, from an objective point of view, our differentiator is our focus, not just on ensuring that we pay claims for the services that they access, but that we are genuinely interested in them living longer and healthier. And we have invested over the years in the technology to ensure that we deliver this. I spoke earlier about our HealthSync app, and I believe this is a game changer in the market. And what it ensures is that measurement of your health is not something that happens in between visits. It is not something that happens when you go to the clinic, to the surgery, or the hospital. It's something that is always on. When you're sleeping, when you're walking, when you're running, when you're seated and you're watching Friday Drinks, it is tracking everything that's happening, your vitals. And what's also important is that you are able to also track your benefits. You're able, at the click of a fingertip, to check what are my benefits? How many consultations am I supposed to have? Can I visit the specialist? Are there any exclusions that are part of what I have? All this is on your fingertips. And what it also means is that even for a principal, they're able to have a look at the beneficiaries, utilization of the product across all the beneficiaries that they have. So it gives control, and this is something that we feel the market has yearned for such a long time. So I think
Okay, so
this makes us...
you know what I like about this is this idea of giving someone an end-to-end product.
Yeah.
And when you think about if you're in the diaspora, you just don't want the headache. All you want is on a click of a button, you want access to medical aid, and you want to know that your parents, especially, and I think that's a very good product that you have. You want to know that your parents are going to be okay.
Yeah.
And you want to know that they're going to go to a medical aid. They're going to go to a medical facility. They're going to get the help that they want, the drugs that are there, and also preventative measures and everything. And it's end to end. That's what's exciting me. How about you? How about you?
Well, I'm a techie, as you're well aware. I like gadgets and devices and apps, and I think it's long overdue actually to be able to have an interaction with a medical service provider through an app and see what your benefits are, what's happening with the other beneficiaries of your account, and just a seamless and a digital first experience.
So if I'm in the diaspora, will I be able to see, the doctor's report, my parents' doctor's report, the drugs that they're taking, what the consultation, what actually happened in the consultation, rather than to hear it from my parents? Can I hear it directly from the doctor?
Yeah. So I think as the person that is actually paying for the package, you will have access to how the account is utilized, and you can engage with the service provider if you feel that you'd like more clarity in terms of how the outcomes of the medical intervention are going through. Because I do know for most people, you want to understand whether they've gone to see a doctor. It's the third time, perhaps. Is it actually working? Are they getting the best service? So you can have access to this. You can engage and interact. And it's a good question you've raised this, because as an institution, this is something that we're also focusing on, a strategy on outcome-based results, where we are trying to move away from just focusing on visits and claims, and to actually see whether the interventions, the consultations with the clinicians are actually yielding an improvement in terms of the patient. So yeah, certainly it's something that we're focused on as an institution.
Zimbabweans are traumatized by 2 episodes of
Yeah.
hyperinflation, and a lot of people who were fully paid up in terms of their medical aid had awful experiences where at the material time that they needed to access healthcare, it wasn't available because of what was happening with the currency. And a lot of people are still skeptical about getting medical aid because they've had these bad experiences. So what assurances do you have if you were to speak directly to people who had horrible experiences during hyperinflation and haven't been on medical aid? What would you say to them?
So for us, we really empathize with the Zimbabweans. The experience you are talking about is one that we all went through as a country. But I do feel that obviously interventions are in place to make sure that, to borrow from street lingo, there's no paper 2 or paper 3 or 4 of what happened. But the assurance that I can make to Zimbabweans is that as CIMAS, we are committed to seeing out the best possible outcome for them. Obviously, we are a stakeholder that is part of government. We support government. So our broader focus is on just ensuring that ultimately, despite of whatever environment that we're in, we're able to fulfill our broader objective, which is to ensure that they're able to access health services. And in whatever environment we're in, and we've been in many, we actually formed just after the Second World War. We still managed to come through for our members. And I think we'll do the same. We're an agile institution, and we'll continue to make sure that we try our best to make sure we serve our members in the best way possible.
Well, on that note, I think it's important and pertinent to remind our audience that you've been around for 8 years.
Indeed.
You've seen, the turbulence and the turmoil in Zim, the highs and the lows, but you're still standing, and you're, the largest private sector medical aid, which speaks well to what you can actually do in our marketplace. Yeah. And I hope that the audience has enjoyed this. I certainly have. I've learned quite a bit. I think the new product that you are introducing will be very, very, very good for the diasporans. So well done, and welcome to the marketplace. Cheers.
Thank you.